A middle-aged woman, Lady A, came to the cardiology clinic complaining of chest pain. From her strong accent, the doctor could easily tell that she was either from South America. After listening to her symptoms, it was clear that she needed to be admitted to the hospital for further testing for angina. When the doctor recommended hospitalization, she hesitated. Then she said, "Actually, I'm from Colombia. I don't have health insurance, so I came using someone else's insurance card. Is that okay?" Lady A is clearly in need of medical treatment. But now the doctor faces a difficult decision. Should they go ahead and treat her using someone else's insurance? Or should they refuse treatment or even report the situation?
In US, many people have no health insurance. So even though many people feel sick or pain, they cannot see a doctor. Out of sympathy, some people lend their insurance cards to these so they can receive treatment. But this kind of fraud comes with serious consequences. It undermines health insurance system, distorts medical records, creates confusion in patient histories, and increases overall insurance costs for everyone. It can also encourage bigger and more systematic fraud later on. For this reason, many argue that using someone else's insurance must be strictly prohibited and punished. But this issue isn't so simple. Imagine an undocumented foreign worker from a developing country, working long hours in a dirty, dangerous, and difficult job that most Americans avoid. They contribute to our economy but are excluded from health insurance, simply because they cannot pay insurance premium. When these workers fall ill or are injured, they face medical bills far beyond their means. In such cases, it's not easy to simply condemn them for borrowing someone else's insurance card. On the other hand, turning a blind eye to this kind of fraud also creates legal risks for doctors. However, it's not easy for a doctor to turn away a sick patient, especially if their condition is serious enough to require immediate treatment. Some religious and civic groups have partnerships with certain clinics, allowing people with no insurance to receive medical treatment at reduced costs. But these clinics are usually small and cannot handle serious conditions such as heart disease or cancer. And even if treatment costs are covered, the cost of medications often remains a barrier. Should doctors turn a blind eye to health insurance fraud? Share your thoughts and opinions in the comments.